Hi everyone. If you're watching this, you're probably in allied health or heading there. So you already know that good communication isn't just a soft skill. It's actually an ethical responsibility. And today I wanted to talk about the ethical side of communication and research and what that looks like in a day-to-day practice. So let's start with the basics. What does scientific communication actually mean? At its core, it comes down to a few key principles: accuracy, transparency, objectivity, and reproducibility. So, when we share research findings, whether that's in a report, a patient handout, or even a conversation with a colleague, we have an obligation to represent the information honestly and completely. Um, so that means not cherry picking results that support what we want to be true, um, and being upfront about the limitations of the data. It also means making information accessible, so not hiding behind jargon when we're talking to patients or families who need to actually understand what we're telling them. So now when we layer human subjects into research, the ethical stakes get even higher. Um, the foundation of research ethics comes from things like the Belmont Report, um, respect for persons, um, beneficence, and justice. And as allied healthcare professionals, we're often the ones closest to patients during research. So that means that we play a real role in making sure informed consent is genuine, not just a signature on a form. Um, Patients need to understand what they're agreeing to, what the risks are, and that they can say no without it affecting their care. So we also have to be on guard for vulnerable populations, people who might feel pressure to participate, like patients who depend on us for their care. Our scope of practice matters here too. Um, so that's why we follow like IRB protocols, make sure that we document everything accurately, and we don't escalate concerns, or I should say, we only escalate concerns when something doesn't feel right. So, some communication pitfalls that we need to watch out for. Um, One is misrepresentation. So, whether intentional or not, overstating findings, using misleading statistics, or presenting preliminary data as conclusive, that can cause real harm when other professionals or patients act on that information. So there's also the issue of confidentiality in research settings. Um, we handle patient data constantly. And even in casual conversation with coworkers and team meetings, we have to be careful not to inadvertently disclose identifiable information. And then there's conflict of interest. If research is being funded by a company with a stake in the outcome, that needs to be disclosed. Transparency about who's behind the research is part of communicating ethically. In practice, effective communication looks a little different depending on who you're talking to. So with patients and families, I try to use like plain language. I check for understanding, not just being like, do you have any questions? But actually asking them to repeat back key points. Like, I like to meet people where they are, and I'm always honest, even when the information is hard to hear. Cultural sensitivity matters here too. Communication isn't one size fits all. Um, with other healthcare providers, it's always about being concise and precise. So, using the standardized tools like SBAR, situation, background, assessment, recommendation, that helps make sure that nothing gets lost in the handoff. And within scope of practice, I know when to communicate a concern upward rather than acting outside of my lane. And finally, written communication deserves its own attention because once something is written, it's part of the record. So, formal correspondence, whether it's a referral letter, a care summary, or an internal report, it should be clear, it should be professional, it should be free of ambiguity. I always consider the audience. So, what does this person need to know, and like what format serves them best? I proofread carefully. I avoid abbreviations that might be misread, and I make sure any sensitive information is shared only through the secure channels. In research context specifically, documentation needs to be thorough and accurate because the paper trail matters for accountability and reproducibility. So at the end of the day, communication is one of the most powerful tools that we have as allied health professionals. And with that comes real ethical responsibility, whether we're talking to a patient, writing a report, or sharing research findings. How we communicate reflects our integrity as practitioners. So, thanks for watching.